Level 989.
Welcome to 989 on Health, the show where you don't need years at university to understand the latest news about health and related subjects. As always, please remember we've created a list of handy links to more info on today's topic at our website, level989.com.
An important announcement for our listeners. This podcast is intended to be an informal tool for laymen and practitioners alike to hear our viewpoints on health and wellness. Don't rely on the information in this podcast as an alternative to medical advice from your doctor or other professional healthcare provider. For the full disclaimer, please see our website.
I'm Mike Davalos, just a guy, your average Joe, and I'm joined by the opposite of average, Brandon Weintraub, a primary care physician. Good morning, Brandon.
And good morning, Mike.
Our topic for today is locally sourced artisanal medical devices. And I have to admit, we're being a bit silly and coming up with our own quirky name for something that's actually very important. Brandon, between the two of us, you're definitely the hipster. Would you care to explain what makes something locally sourced and artisanal, and how these terms could possibly apply to medicine? I mean, it's a well-known fact that the world's best medical devices are all fabricated in a high-tech clean room somewhere in Germany.
I considered objecting to being called a hipster. I like to consider myself more of a nerd, but then I thought better of it.
Smart man. So you are about to explain locally sourced, artisanal medical devices.
For the most part, it's just a quirky name, but locally sourced means found or made nearby, while artisan generally refers to an item being made in a non-mechanized way, essentially handmade. Most medical equipment is mass-produced, fabricated in large factories, and engineered to very specific tolerances to produce precise, consistent results. But let's be honest, not everything needs to be as finely tuned as an MRI scanner, or cost large sums, like, for example, the $1 million you'd spend on an MRI scanner. And that's just to buy the unit. Keeping it running properly and safely is a never-ending series of costs and effort very few people can afford.
So what are we talking about here? People just heading out to the garage, grabbing a hammer, banging out their own medical equipment? First of all, can't believe I'm the one saying this, but this sounds dangerous, not to mention illegal. So this is something we're opposed to, right? We're getting the word out about the dangers of trying to build your own X-ray machine. It might actually be kind of cool.
I never thought I'd have to give this warning. Please, kids, don't build your own X-ray machine. X-rays are very dangerous. While the average person in the developed world has little reason to build their own medical equipment, not every country is as fortunate as the United States. There's a lot of simple equipment that could be constructed which may not be made of stainless steel or tempered glass or high-tech plastic, but would still do the job and improve patient care.
Oh, so this is a good thing. I get it now.
Well, like most things, I'd call it both good and bad. Many countries in the world still lack stable governments, reliable electricity, and access to clean water, not to mention well-funded social services and the medical infrastructure to care for the sick and the injured. And that's the unfortunate reality for millions of people. So even though I'd love for everyone to have easy and permanent access to top-of-the-line medical technologies, that simply isn't the case. The good part, of course, is that people are smart and resourceful. And when the need arises, they'll always find ways to create what they need.
Okay, so it's not good that it's necessary, but good that people are taking action however they can and making a difference. I think I saw a news story in The Economist about this recently. A very smart man has come up with something I can only refer to as a contraption made out of string and cardboard, and it has something to do with blood samples. Can you break this down for us? What does this thing do? Why is it important?
Dr. Manu Prakash of Stanford University and his team have created, from a toy that's been around since as early as 3300 BCE, an incredibly useful medical tool. By utilizing a cardboard tube and some fishing line, they've created a fully functional centrifuge. For those who may not know, a centrifuge is a machine that applies force using high-speed rotation to separate fluids of different densities or liquids from solids. Why would this be useful in medicine? Well, Western medicine relies on results from tests of various bodily substances, for instance, blood, that can only be broken down and separated into their individual components by devices like a centrifuge. A basic benchtop centrifuge can be purchased for as little as $300 or so. but they require regular access to electricity, regular maintenance, and are quite heavy. The device developed by Dr. Prakash and his team costs about 20 cents to produce. It's operated by hand, and it weighs about 2 grams. This makes the paperfuge, as it's been dubbed, extremely useful for shipping to isolated areas.
The name Dr. Prakash sounds familiar. Didn't he also invent some kind of microscope out of paper and a watch battery? I seem to recall some issues with the microscope, though. I have some vague recollection of a banana connection as well. I know you love to talk about bananas. What's that all about?
That's the same guy. He and his co-inventor invented a microscope, made from paper no less, just like you said, that gave somewhat remarkable magnification at a fraction of the costs of your average microscope. There were some difficulties with the device when they tried applying it to the field of medicine, though. The device needs to be held up to your eye, and the sample ends up very close to your face. There was some difficulty keeping the samples, and worse, the people doing the viewing, from contamination. That said, there were, or are, I'm not entirely sure, plans to make a medically viable version that's expected to cost about $10. As for the banana, I seem to recall that their Kickstarter video used a banana to compare the size of their device to the size of a banana. This is likely a reference to an internet meme that refers to using a banana for scale.
I seem to recall the foldoscope being used to check for banana fungus. I think that's the banana connection I was thinking about. In the US, we tend to think of healthcare and medical devices as an exclusively high-tech domain. The device must somehow use magnetism or ultrasound, or at the very least electricity, but among the most important basic parts of healthy life is clean water and clean food. There's been a lot of low-tech advances in water purification, and one of the coolest, and possibly best known, is the LifeStraw series of products. What I think is really great about this, that it didn't just remain a scientific paper. These are real-life things you can buy right now. Can you explain the LifeStraw products for us and why they're important?
The human body is about 60 to 70% water. In many cases, a human can go for about 3 days without water, and that's opposed to the 3 weeks you can go without food. According to the World Health Organization, by 2025, half the world's population will be living in water-stressed areas. That's what makes something like the LifeStraw so important. The LifeStraw is basically a water filtration device capable of removing, in the most recent form, 99.9% of protozoan parasites, as well as a majority of bacterial life.
Just a quick interruption here. Can you make it clear, why is removing protozoa and bacteria important specifically? I mean, how can they make you sick?
There are a wide variety of possible illnesses that are caused by some of the pathogens found in contaminated water. One especially concerning protozoan is the Cryptosporidium. It's resistant to chlorination, and even the United States has experienced outbreaks, the worst of which affected over 400,000 people in Milwaukee in April of 1993. This little parasite can cause significant intestinal distress, as well as affect the respiratory system. A bacteria that can be found in impure drinking water is one I'd bet most of our listeners are familiar with: E. coli. E. coli is associated with diarrhea, urinary tract infections, respiratory illness, pneumonia, and a number of other illnesses, and can be contracted from contaminated drinking water, not just raw meats and eggs. While both these diseases can be treated in a first-world environment, in a situation where medical care may be stretched thin or adequate sources of nutrition and hydration are lacking, they can quickly become devastating. The LifeStraw Family Edition can filter 18,000 liters of water, which means relatively clear water for a family of 5 for up to 3 years. It ships easily and has already been shipped to various locations as part of public health campaigns or during times of emergency. It was sent, for example, to Ecuador after the 2016 earthquakes, and Thailand in 2011 after the severe floods there. It uses only physical means for filtration, no chemicals, which means no expensive or difficult to obtain ingredients to make the device work. It's worth mentioning, though, that the device doesn't filter viruses or chemicals, salt, or heavy metals, so there's still plenty of dangers to worry about if you're looking to just stumble upon a source of drinkable water. But the ability to avoid an illness like Giardia or cryptosporidiosis is pretty impressive.
One medical technology problem that needs solving is the very delicate, high-tech nature of medical devices. Let's say a very compassionate group of people donate thousands of dollars and buy, say, an incubator to help premature babies for a remote village in Nicaragua. Now, an incubator can sell for as much as $50,000, and as we mentioned before with the MRI machine, you also have to repair and calibrate the equipment over time. So while the donation of an incubator was a very kind, sweet gesture, as soon as the machine breaks down and no one can fix it, well, and let's be clear, people are resourceful. The device stays broken not because no one in the village has any techie skills, because people are clever and skilled the world over. It's that these devices are designed in a very component-based, modular way. So in a hospital, in a big city, when an incubator breaks, you just order a new part, which could easily cost $20,000, and the hospital pays the next day air shipping to fly it in from Sweden, and the repairman slots the new part in the chassis within about 10 minutes. It's not difficult to repair, just insanely expensive, because the village in Nicaragua is not built into the system that supports these sorts of devices. All of which makes the artisanal medical device all the more necessary. I think you even have a perfect example to demonstrate my point.
Indeed I do. Let's talk about Designs That Matter. It's a nonprofit organization that created a device called NeoNurture. NeoNurture is an incubator which utilizes car parts for many of its essential functions. Why car parts? Well, even less developed countries generally have plenty of cars, and general knowledge of repair, and availability of replacement parts is often in greater supply than the specialty parts you would need for a regular incubator. NeoNurture uses sealed beam headlights as heating elements, a dashboard fan for heat circulation, signal lights and door chimes to serve as alarms, and though it runs off regular electricity in an ideal situation, it has a motorcycle battery and a car cigarette lighter as backup options for use in power outages or when moving the incubator. Keeping newborns in a warm and safe environment is especially critical, so this device can definitely make a difference in places that are still developing their infrastructure.
And healthcare, right up there with clean water and clean food, are other basic hygiene needs. And one story that caught my eye was processing locally grown banana leaves into sanitary napkins. It's always such a weird phrasing for me. From my perspective, a napkin has an exclusively food-related connotation, but I'm just an ignorant male, I guess. The story was about young ladies going to school in Africa, and how a lot of the girls would miss 50 days of school in just one school year because they didn't have access to menstrual pads. It wouldn't occur to me that this would be such an important need, but once you think about it, it makes a lot of sense, especially when you consider the impacts of women getting a good education in third world countries. The term third world just seems so disrespectful somehow. And it's not what I mean. It's just a quick shorthand for me as places in the world where they don't have what they need. Can you explain why something as simple as sanitary napkins and so unfortunately complex as education for women is so important?
Before I say anything else, let me admit, this particular product is one I hadn't seen up until we began preparing for today's podcast. Sanitary napkins do seem like a really simple idea. But keep in mind the production of an affordable and disposable sanitary napkin didn't happen until reasonably recently. Johnson & Johnson were potentially the first in 1888. For our listeners who don't know, sanitary napkins are also known as pads and are used by women during menstruation to absorb discharged blood. Prior to the invention and introduction of disposable pads, women often used a variety of washable cloths for the same purpose. In a situation where materials are available, this would be just fine, but inadequate cleaning or lack of supplies in general lead to a situation where bacteria are practically encouraged to proliferate. Inadequate hygiene can be a significant factor in a host of illnesses. To make matters worse, there's a social stigma present in even discussing anything related to menstruation, even within families, and yes, even here in the United States. Education is one of the fundamentals currently lacking in much of medicine today, even though the most fundamental education can improve health and wellness overall. There are plenty of places where women are lucky to get any amount of education at all, so the thought that something as little as an absorbent pad might take them away from an opportunity to learn is an unfortunate one. Banana fiber-based pads are a step in the right direction. They're made from available materials, and they're mostly biodegradable. There are some downsides, though. The machine for producing the pads, according to one of the articles I read, costs about $1,100 US and requires a steady availability of electricity to run. And while it's possible to make these items in larger city centers and then distribute the pads to the more isolated areas, costs and delivery of those items just isn't feasible in most cases. Regardless of the feasibility of this particular product, I think we can clearly see how simple it is to take mass production for granted, and how critical it can be for inexpensive, effective options to be made available.
I gotta say, doing research for this topic was a bit tricky. Usually the topics we discuss have scientific names with hundreds of years of research behind them. And everywhere from the National Institutes of Health to the Mayo Clinic, and yes, even Wikipedia, always have a ton of great articles and links on any disease or medical topic you can imagine. But there doesn't seem to be an established blanket term for the do-it-yourself medical devices. Not one I could find anyway. Did you find the same thing?
I definitely encountered similar problems. When we discussed the idea initially, most of the devices I had in mind were from websites trying to crowdsource funding for their development, or single articles I had come across in the past but never really researched in any great depth. Once I started trying to find statistics on their use, or examples of places they were implemented, I found an unfortunate truth. The information on artisanal medical devices is scattered and random. Most come in the form of annoying clickbait news stories with titles like 10 Amazing Handmade Third World Medical Devices. If you try and load the webpage, you find yourself in an ad-infested malware nightmare with little more than a lackluster picture slideshow for your troubles.
Yeah, that's exactly what I found, yeah. Now, not that it's our listeners' concern how difficult the topic was for us to research. I only mention it because it's not good that the information is so scattered, hard to find, and hard to read once you do find it. It really seems like an important topic that a university or maybe even a nonprofit charity could decide to champion, really collect and present the information in a more usable way. And by usable, I mean diagrams, schematics, building steps, a user forum to help people. There are websites like Instructables.com that have a great array of gadgets you can build. But it's all this geeky, techie stuff. Like you want to build a custom circuit board that pairs your car's garage door opener to your iced tea machine. So when you get home from work and open your garage door, fresh tea begins to brew automatically. Now, I'm not putting down Instructables.com here. I'm saying it's a very usable site that actually helps people build things they find useful. I just want to see that method applied to these artisanal medical devices.
Well, I will happily admit to browsing Instructables on a regular basis, and I definitely agree it would be marvelous, in some ways, to see the devices like the ones we're discussing available in a more open-source, easily accessible medium. There are issues that would need to be addressed, of course. Not all devices listed here are useful to people without additional training. The thought of someone reading a 2-page article and then trying to use a homemade centrifuge and microscope to determine if they have a serious disease makes me a bit uncomfortable. But since the nature of the tools we've talked about so far is to provide access where there would otherwise be none, I definitely would love to see schematics and details made available.
Now, this doesn't sound like a very low-tech, handmade thing, because it isn't in the slightest, but cell phones have really made an important impact in the developing world. It's very costly to install the thousands of utility poles and miles of wires needed to connect every community to phone service. So a lot of remote places are skipping the landline stage and going from no phones at all directly to mobile phones, even if they're what we consider to be the old-fashioned flip phone or bar phone style. And how can a cell phone help with healthcare? Well, the Consumer Technology Association has an interesting post with a few examples about this. I'm going to do some quoting here. The Grameen Foundation's Mobile Midwife Program sends women daily texts and weekly voicemails with advice in their language during pregnancy and the first year of the child's life. In Mozambique, mobile is being used in the fight against HIV and AIDS. British nonprofit Absolute Return for the Kids, or ARC, incorporated mobile messaging to remind patients enrolled in antiretroviral therapy about appointment dates and to take their medication. Mobile messaging improved retention rates. 96% of users were still on track with their therapy after 6 months, and 85% after 12 months, compared to the national average of 72%. UNICEF's M-Track looks at the health system itself. About 30,000 frontline health workers at 3,700 health centers in Uganda submit weekly reports electronically and are able to receive surveys, alerts, and other communications. Are supplies arriving on time? Are levels sufficient? Is the clinic storing medicines properly? On the more complex side of things, Brandon, did I see something in the research about blood tests with a smartphone screen? How can this possibly work?
This product was a new one to me as well, and having read up a bit on it, I have to say I have my doubts about its implementation. But description first, then personal asides. The startup Cloud Lab, spelled with a Q instead of a C, is interested in testing the coagulation of a patient's blood. Coagulation, just so you don't have to ask, is part of what causes a cut to stop bleeding. But there are instances when a patient may need to be put on a medication to thin their blood and reduce the amount of coagulation that occurs. For example, if there's been damage to the heart muscle. In order to keep complications from occurring when on anticoagulants, patients must have their blood checked regularly to ensure appropriate treatment. There are tests already being produced that patients can use at home, but Cloud Lab Test allows results to be sent directly to the patient's physician. The device itself acts a bit like a personal blood sugar test. Blood is wicked into a small disposable strip and reacts with a testing agent. With the Cloud Lab Test, you would put a special microfilm onto your phone, which would then send the data, by the same method your phone uses to determine if and when you're touching your screen, to a special application designed for the device. Now, I haven't seen the patent the company has filed for, or the proof of feasibility that accompanies it, but I have to wonder about the accuracy you'll actually get from this method of testing. People putting the film on incorrectly, or maybe even a dirty screen, could keep detection from being as ideal as it could be. There are a ton of different factors I can imagine that might affect usage. I can't help but wonder if a separate device, connected by Bluetooth, might remove a lot of the possible errors involved. That's all conjecture, by the way. It's not meant to disregard the device's possibilities. I have no doubt we'll be seeing our cell phones put to more and more use as they become integrated into our lives and their processing power continues to improve.
This is a topic really that has no end. There's hundreds of different handmade, homegrown medical devices being developed and used across the world, saving or improving thousands of lives. We always have a bunch of useful links for each episode. These can be found displayed in your podcast app of choice and at our website, level989.com. We have a long list of links this time, but we warned a lot of them are the clickbait, flashy ad news stories we just complained about. Is there anything else you want to mention before we wrap it up?
I was initially drawn to this podcast topic by an influx of fun little articles I've seen over the course of the last year or two. I'm not sure what caused the apparent spike in public interest here in the US. I suspect ongoing insurance coverage concerns, increasing costs of medical treatments, and concern about the availability of certain tools and medications may all have played a role. But I'm excited that people are beginning to take an interest in the accessibility of medical tools. The key thing to remember is that the goal in developing these artisanal devices, as we've called them, isn't to replace the technology being used in modern medical science. It's to provide economic access to some of these tools in situations where they might otherwise be absent. It is my hope that as interest in these sorts of devices continues to grow, and with a bit of perseverance and ingenuity, more and more advanced technology will become available to wider and wider populations. It may start with cardboard centrifuges and paper microscopes, but eventually, maybe, we'll see the portable diagnostobox with onboard treatment options. It scans, it diagnoses, it tells you what local plants and minerals it needs, and then it mixes the medicine for you. All powered by the included battery pack. Delivered anywhere in the world by drone, only $59.95, free shipping. Now also compatible with your Android and Apple devices.
That's all the time we have for today. These are short episodes that provide a brief overview of very complex topics. Everything we say is for entertainment and educational purposes only. Licensed healthcare professionals should advise you and be aware about changes you make to any aspect of your healthcare. Every person's needs are different. The links to references we've made about news articles, medical studies, or other materials can be found at level989.com/health, along with our contact information and the complete Don't Take Medical Advice from Podcasts disclaimer. Thanks for listening, and now go health yourself.